Thank you for being a part of helping EliteMed for conducting this workshop, sir. And tell me about your day here in JSS Medical College.
Yeah, I'm actually assistant professor in Department of Radiology. I'm mostly into diagnostic radiology, but I do a lot of non-vascular intervention as well. So if you take it, it's like 60% is diagnostic and 40% is intervention is what I do.
Okay. So, if I may ask, what made your interest in interventional radiology, or what made you have the special interest in interventional radiology?
Yeah, when I joined my course, I was not very keen in getting into intervention radiology. I had my professor who was interventional radiologist. He was there with us for a short time. He was basically from Singapore and he was here with us for a couple of years. So during my course, I worked under him and I saw him doing procedures, and I used to help him a lot with his procedure, because intervention radiology, it's better when you have a team. So that's how we work. So when I was working under him, I slowly started liking interventional radiology, and it is something that to break your monotony.
Yes.
This is something where you get to do some action.
Yes. So, can you describe a specific instance where you have seen intervention radiology make a specific impact on a patient care or outcome of a diagnostic radiology perspective, from a diagnostic radiologist perspective?
Yeah, in that way, is intervention radiology is basically, it adds added values for diagnostic radiology. First, you need to get to know that there's a lesion or a pathology in the human body. After that, you will start characterizing it. So diagnostic radiology is also equally important. First, you need to see what is there inside, and after that, to characterize, intervention radiology plays a major role, because getting a HP diagnosis, histopath diagnosis, is most important. It changes the clinical outcome to significant level. So I would say both intervention and diagnostic radiology play a equal role.
Yes. So, from your experience, how your career has evolved from taking up both diagnostic side and also the interventional side at the same time, and what's your message to the diagnostic radiologist out there, like, who doesn't want to have a full-time career in an interventional radiology, but still there are certain procedures even they can do? So what's your message to them?
Most of the diagnostic radiologists will be skillful enough to do non-vascular interventions, because if they're, for example, if they're doing ultrasound every day, so ultrasound guided procedures will not be very difficult for them. They can do it. And giving the HP diagnosis has changed in every aspect of clinical treatment. If a person has to get a chemotherapy, for example, for tumors, so HP diagnosis plays a major role there. So just giving diagnosis based on radiology, diagnostic radiology, giving couple of differentials, even the clinicians will be in a difficult place to further go ahead. But if you succeed to get a material out of it using your intervention skills and give them a HP diagnosis at one sitting, that will change the clinical path of the patient.
Yes. So, what technological advances or innovations have you witnessed in interventional radiology that have revolutionized the way procedures are performed and improves patient outcome?
To be frank, the increase in resolution of ultrasounds has changed a lot. Better visualization of the needles within the body has made a lot of difference. So that will change in getting the tissue from a smaller lesions to reach out the smaller lesions, and even the CT guided procedures with multiple slices, it's much easier to do. Of course, it's a growing branch, and it's been evolving from past couple of decades. So I'm very keen to see what's there in future.
How's your work life every day, sir? Are you able to balance work life and there is a myth out there that if you are into diagnostic radiology, then it's like a white collar job, like 8 to 5 job.
Yeah.
But if you are into many are stepping back without going into interventional radiology, thinking that they will have to lose their day-to-day work-life balance will be lost. So, what's your message to that?
Well, I am into intervention radiology. It's not full time for me. It's like part time. Like I have interventions on couple of days, and rest of the days I'm into diagnostic radiology. So when you are in intervention radiology, of course you'll have to do follow up care. Follow up was there, and that will be little tiring. And the long day procedures, you'll be very tired, and you can't do anything that day. And when you're exposed to a lot of radiation, you will be tired for sure. Thing is, my message is you should balance the, both diagnostic and intervention, not get into intervention completely. No, that's your choice. If you're interested in that, you can go ahead. But if not, you can actually mix match, and you can keep 1 or 2 days in your week for intervention, and you can do follow up of those patients, and I think you can balance it. There's no big deal.
Yes, sir.
You can do wonders by doing that.
So, when we take about pan India and when we think about rural areas in India or some remote places in India where we don't have reach for interventional radiology, but still we have diagnostic radiologists over there. And how about them getting in certain particular minor procedures which they can do and which will improve the patient outcome?
Yeah,
so from your life experience,
that will make wonders. To be frank, if the rural areas diagnostic centers, if they start doing ultrasound guided aspiration and FNACs, they can create wonders actually, because most of the times it's patients will get treated based on only radiological reports. They won't have they won't have places where they do diagnostic radiology and get a HP diagnosis. So if that is reaching the rural areas, that will make wonders, to be frank. And it's not very difficult, because if one is skillful enough to do good radiology ultrasound, he will definitely have skills to do the intervention along.
So he
at
just
least the
needs a
ultrasound guidance.
hands-on push or a hands-on training.
Yes, I think he should be exposed to the procedures. He should see them, and I think once if he is exposed to someone doing that procedure, he'll go for it.
Okay, wonderful. So if you were speaking to a group of medical students, what message or advice would you give to encourage them to explore radiology or interventional radiology? Because some students, medical students, when we talk to, some are more interested or they're fancified about surgical specialty.
Yeah.
Maybe that is the reason they don't take up radiology. But there is still, they don't know, there are still things that they don't know about. There is interventional procedures, they are yet to know about that. So what's your message to the medical students out there about radiology or intervention or any specialty?
I would say once you get into radiology, you will have a very broad pathway. You can choose the multiple pathways, to be frank. You can either be full-time in the OT, being an intervention radiologist, or you can be a diagnostic radiologist doing white collar job. So you have options of both. So I would say intervention radiology is future. So most of the procedures are already taken away from surgeons. For example, aspiration of abscess or anything in the abdomen, pigtail catheterization, all those procedures are already taken over by the radiologists, diagnostic radiologists or intervention radiologists who's doing those procedures. So eventually many procedures will be taken over by the radiology. So we'll have lot of work to do in from our end. So if you want some hands-on job, you can get into intervention radiology, or if you don't want to do that, you can just do your diagnostic radiology. What I would like to say is you'll have option of both. but once you become a surgeon, you can't do anything else apart from that.
Yes.
But if you're a radiologist, you can get into interventional radiology and you can still be a surgeon.
What's your thought about introducing radiology and interventional radiology into medical students' curriculum and exposing them to the specialty during their internship time itself? More exposure.
Yeah, the more the exposure they have, I'm pretty sure more they start liking the subject. So in our curriculum, at least in India, exposure to radiology is very minimal. They would, because at least when I was doing my undergrad, I was never exposed to radiology. But nowadays, I see undergrads coming to us with doubts, or coming to us asking how the department is, subject is, and they're more keen towards the radiology. Yeah, towards radiology, there's enough exposure for undergrads right now, but for intervention, not much. So by doing programs like this, I think they'll be motivated, and definitely this will give some impact on them.
Okay. Sir, could you share some personal anecdotes or cases that highlight unique challenges that you have faced, or any interesting case that you remember in your experience, just to...
Many, to be frank, but recently, yeah, I have faced a lot of challenges when I'm doing PTBD, where the dilated ducts are not not very dilated, where the lumen is very narrowed. So catheterizing those have been a challenge for us, and again reaching the lesions which are too deep, or subdiaphragmatic lesions for livers, and those are some of the challenges that we have faced during our non-vascular intervention. To name one of them, I think PTBD, where the lumen was, caliber of the lumen of the dilated duct was too small,
Okay.
but somehow we managed to put in a catheter,
Okay,
and that changed. That helped the patient a lot. We did internal catheterization, and that helped the patient a lot.
Okay. Sir, before wrapping up, what's your thought about the workshop we conducted today here, and what is your thought, in future, how we should be doing it, or how to reach into more medical students or interns? Should we do that? Or...
Yeah, it was a brilliant workshop. All thanks to you guys for making it happen. And the faculty who came in, they're well knowledgeable persons. So we learned, forget about my postgraduates, even I learned a lot of things. And somehow we managed to get the vascular intervention model. So that was a very good thing that happened today.
Yes, sir.
In future also, if you are conducting more workshops, try and concentrate on vascular
Yes.
setup with mannequins with vascular setup. So postgraduates wouldn't have been exposed to that, so that will help them a lot, because they'll just read it in textbooks.
Yes.
And it's only their imagination.
Okay.
At the most, they would have seen a couple of videos. If not, doing these doing this stenting and all by themselves, here it is a game changer for them.
Okay.
It will definitely, they won't forget this.
Yes.
So these procedures, if it's asked in exams, they'll definitely come out with flying colors.
Wonderful. I'm also
Yeah.
happy that our vision has been...
Yes, it has
Yes.
definitely been. It's been a brilliant workshop.
Yes.
Thank you. Thanks a lot for that.
Okay. Thank you so much.
Thank you.
Okay.
Okay.